Hello everybody, welcome back to DaVinci Academy's Chapter 7, Head and Neck. Here we're going to talk about the Pterygopalatine fossa in our Lecture 7. Again, this is probably a very short chapter, just like the infratemporal fossa. So, the Pterygopalatine fossa, or the sphenopalatine fossa as it's also called, is a very small structure located very deep in the face. It's very hard to find in a cadaveric dissection. It's very hard to even find on an anatomical model. It is a very small little cone-shaped cavity deep behind the maxilla, inferior to the orbit, to the apex of the orbit, and it's pretty much just a continuation medially of the IT fossa. And the reason why it's so important is because there's so many different neurovascular structures that are very important as they communicate with nerves and arteries going to the nasal cavity and the oral cavity. And again, it's just a very unique area of the body that's really almost unprecedented. And what's important again is this whole concept of this pterygomaxillary fissure that we discussed in the infratemporal fossa lecture, where you have this little window called the pterygomaxillary fissure. That's pretty much all it is just an entranceway from the IT fossa to the PT fossa. So we're going to talk about the boundaries real quick. So again, there's very many and numerous different important borders for the PT fossa, but we're going to kind of discuss the bony borders real quick. So immediately you have the perpendicular plate of the palatine bone right here along this border. Laterally you have that pterygomaxillary fissure. This is the fissure right here. Inferiorly you have the pyramidal process of the palatine bone. Anteriorly you have the infratemporal surface of the maxilla. So this is kind of what we're looking at. It's kind of like this window right here is the infratemporal surface of the maxilla, and then posterior you have the pterygoid process, this shaded area. And those are pretty much your bony walls to it. Again, maybe not too important when you're trying to actually talk about this clinically, but just to orient yourself. So we're going to talk about the contents now. So there's pretty much four big overarching contents that kind of come through this area. Even though it's so small, there's four contents, which is hard to believe. One is the vidian nerve, or the nerve of the pterygoid canal. Another one is the pterygopalatine, or the PT ganglion, also called the sphenopalatine ganglion. And pretty much this is just a parasympathetic ganglion that carries parasympathetic nervous fibers from the greater petrosal nerve, cranial 7, that innervates the lacrimal glands, the palatine nerves themselves, and provides parasympathetic innervation to the nasal mucosa, and it's just located deep inside this structure here. It also contains a passageway for the maxillary nerve, V2, from the posterior side, from this darker side, and then also contains a terminal portion of the maxillary artery as it comes in through this pterygomaxillary fissure. So we're going to talk about the pterygoid nerve of the pterygoid canal, or the vidian nerve, first. So this is a union of two different nerves. It's a union of the greater petrosal nerve, which contains preganglionic parasympathetic fibers from cranial nerve 7. Again, it synapses on the PT ganglion for nasal, lacrimal, pharyngeal, mucosal innervation. It also contains fibers from the deep petrosal nerve, which is the postganglionic sympathetic. So this contains innervation from the sympathetic plexus, provide innervation to the blood vessels, the mucus glands of the head and neck, things like that, doing sympathetic functions to the deep face. So how do you distinguish the two? How do you know which one is the greater petrosal from parasympathetic and deep petrosal from sympathetic? The way I remember it is that the deep petrosal, hence the word deep, has to come from the sympathetic trunk. And the sympathetic trunk starts way down in the spinal cord, comes up into the face. So I think if it starts deeper in the body, then it comes from the sympathetic nervous system. And I think of the greater petrosal nerve providing majority of the greater mucosal innervations. But the way I remember it is I just think deep petrosal comes from deep down in the body, the sympathetic trunk, and that's the way it works. And you see right here, this is awesome. I mean, this is amazing that you can see it in this image right here. This right here is the vidian canal. So this right here is considered to be like almost like the posterior cranial fossa up in here, and then this is facial nerve. This is facial nerve right here, giving off the fibers going through the vidian canal. I mean, that's amazing to see this in the lateral. And then right here, this right here, this is your PT fossa. So it's as you can see, it's very small, very deep to the face. So I'm going to talk about the communications. So again, knowing the communications is probably the most important thing here, and how things work and in association with the PT fossa. So immediately you got that sphenopalatine foramen that goes to the nasal cavity. And here's the nose, kind of to orient yourself. This is the nasal cavity going this way. Laterally, you have the pterygomaxillary fissure coming from the IT fossa that we mentioned before. Inferiorly, you have the greater palatine canal going to the oral cavity and lesser palatine canal. So the structures are actually going down into here like this, if you can imagine. They're going down in here and then coming out through the greater palatine canal. Anteriorly, you have the inferior orbital fissure to the orbit. I mean, this is kind of, if you imagine, this is where the inferior orbital fissure is, just kind of like riding above. And then posteriorly, you have three structures. In blue, you have the foramen rotundum, going to the middle cranial fossa, and this is where you have the maxillary nerve passing through. You have the pterygoid or vidian canal in green in the middle, and then you have your palatovaginal canal, which also goes to the nasopharynx. So just another access way for nerves. So we're going to talk about the deep face communications as well. So when we talk about this, the sphenopalatine foramen to the nasal cavity is on the medial border. It's a passageway for the cranial nerve V2 that communicates with the greater palatine nerve at the incisive foramen and innervates a lot of the nasal mucosa, the primary palate, the central incisors, lateral incisors, and canines. So it provides a form, an access way for nasal mucosa innervation. That's pretty much what it does. Next, you have the pterygomaxillary fissure. We mentioned this time and time again. This is just a little window into the soul of the PT fossa from the IT fossa. And that's all it pretty much does. Again, the PSA, that posterior superior alveolar artery, branches off inside the PT fossa, as we mentioned before, and then comes back out through the pterygomaxillary fissure, penetrates into the maxilla to provide blood to these guys up here, these teeth. Then we're going to talk about the greater palatine canal to the oral cavity and the lesser palatine canals. So this is a beautiful image right here. I mean, you can see it perfectly. Here, right here, would be a portion of the PT fossa. This is your greater palatine canal descending down, and this right here is going towards the hard palate. This goes to the soft palate, and this is where you have your greater and lesser palatine nerves passing down in this direction. So the descending palatine artery also passes through here. It's not visualized in this image, if you can imagine an artery going down, and the greater palatine artery provides innervation blood to the greater palate, and then the lesser palatine artery provides blood to the soft palate. And I remember this, there's a greater surface area of hard palate, so the greater goes to the hard. There's a lesser area of the soft palate, so the lesser goes to the soft. So it branches into these and provides blood to the palate gums, the palatine glands, but also very important is it ends up wrapping back around the greater palatine artery, wraps back around through the incisive foramen, comes back up through here. It forms this very important anastomosis with a sphenopalatine artery, provide blood to a lot of the anterior nasal septum, anterior nasal structures as well. Next, you have the greater palatine nerve. So the greater palatine nerve is what carries nerve fibers from the PT ganglion, just general sensory from V2, and it communicates with the incisive foramen as well as the nasopalatine nerve. As you can see, these branches coming off this way and branching off to the hard palate. And again, the lesser palatine nerve, again, branch off V2, innervates again, it's the same exact area, just coming down, but going to the soft palate. Right where the palatine and the maxilla come together in union. Next, you just have the foramen rotundum, as we mentioned before in the cranial nerve chapter. And this is just a passageway of the cranial nerve E2 as it enters into the PT fossa from the middle cranial fossa. So this is little windows right here. This is, if you imagine sticking a little tube or straw or nerve right through that hole, that will get you eventually into the PT fossa. This one is the foraminal valley. This one will get you to the IT fossa. So just a matter of very close proximity to get you very different locations. Then you have the pterygoid canal, the vidian canal. It's just my favorite little canal because of how small and tiny it is, yet how important of a structure it is. It's anterior to the foramen lacerum, which is just a benign structure that is where the internal carotid kind of passes over. And this is just important because it has the passageway for cranial nerve V2 artery and veins of the pterygoid canal, as you can see right through here, going into this PT fossa. Beautiful, absolutely beautiful. So then you have the palatovaginal canal into the nasopharynx, and then this is probably one of the tiniest little passageways you'll probably ever imagine. I mean, you may never get tested on it. I'm just here to mention it. It's located between the sphenoid bone and the palatine bone. It connects the nasopharynx and the PT fossa. I mean, other than that, it's very difficult to kind of visualize. It's just a very small little area that I can't even find on this image of the sphenoid bone, but it kind of pretty much passes just like the vidian canal passes into the nasopharynx. Then you have the inferior orbital fissure, which rises on the top portion of the sphenoid bone right here, as you can see on the left. And it's pretty much here. This is the apex of the orbit. This would be your this axis way right here would be your infraorbital fissure, and this is just where you have the passageway of the PT ganglion branches to the lacrimal gland as well. And that's pretty much it. I mean, it's a very short chapter. It has a high yield. Is pretty much is the communications associated with the PT ganglion. If you know the communications, you know the contents. It's pretty much all you need to know with the PT ganglion and the PT fossa. So thank you again. That pretty much, and that concludes DaVinci Academy's chapter of the PT fossa.